Hi, my name is Sarah Dunne. I am an MSN student with an emphasis in nursing education at Mount Mercy University. I will be reviewing my practicum clinical as well as my project over next generation curriculum in the classroom, clinical, and simulation areas. I completed my practicum clinical at Kirkwood Community College with Jessica Rosick, who teaches the second of 4 semesters in the nursing program. She primarily teaches a course called Foundations 2. I had the opportunity of teaching within 2 separate lectures of the surgical unit. Within both of these lectures, I reviewed the syllabus, current content, and the textbook to identify areas to focus attention on. The first lecture I taught was over different types of anesthesia, medications, and reversal agents, including Romazicon and Narcan. I also developed next generation NCLEX style exam questions within the surgical unit. The second lecture was at the end of the surgical unit. Within this lecture, I introduced an unfolding case study I created. As the next generation NCLEX was implemented in April of this year, nursing programs are looking to introduce next generation style activities or case studies every hour. This is to have students focus on critical thinking and judgment skills. The unfolding case study I introduced was a patient within the emergency department that had appendicitis. The patient who would need surgical services and took the students through preoperative, intraoperative, and postoperative services for this patient. Next generation exam questions were also included throughout the unfolding case study, reviewing priority assessments, medications, informed consent, assessment findings, lab results, and patient education over content that had already been reviewed in class. Students were also able to evaluate me with evaluation forms. Most feedback was positive regarding my teaching methods. Students really enjoyed the unfolding case study as a review. I also received feedback from my preceptor one-on-one. She gave me great constructive feedback to how to improve time management skills while lecturing as students got off topic during the case study. Otherwise, all feedback was positive. I had the opportunity of going to 3 separate clinical post-conferences. The first was with second semester students. Discussion was co-led over discharge education, the discharge process, and resources to give patients. I introduced some next generation style questions during the debriefing. The second debriefing was with third semester students. I gave these students a case study and asked them next generation style questions over a surgical patient. The questions triggered more questions from the students that were able to discuss about their current patient assignments. The third debriefing was focused on discussion over ethical issues such as drug diversion, patient neglect, and informed consent. The students did great at working through these ethical issues and what they would need to do during these situations if that ever occurred. I attended 10 program development and staff development meetings. Several topics were discussed within these meetings, including current resources offered to students such as ATI, moving certain topics into different courses to introduce the content sooner to students. These topics included PE and AFib. Faculty also discussed how to add next generation activities, exam questions, and content into courses throughout the program. Each instructor was tasked to add next generation exam questions into the exams the upcoming semester. I was able to attend several simulations from first semester students to students in their final semester, which allowed me to see the difference in learning needs and teaching styles for newer nursing students to students that were about to graduate. I was able to co-lead several simulations, including a surgical simulation scenario that I had prepared several next generation questions during the debriefing to promote critical thinking to the scenario that had just been done with students. I assisted instructing the Foundations 2 lab, where preoperative checklists were introduced and students had to do pre-op patient education over SCDs, TED-HOs, incentive spirometers, log rolling, and turning and coughing and deep breathing. I was also able to demonstrate NG insertion skills for students and then assisted them in practicing the skill on mannequins. The following week, I assisted the other instructors in testing the same students out on their NG skill performance. This allowed me to give students feedback one-on-one based on their performance. Lastly, I was given the opportunity to do a peer evaluation of another instructor along with my preceptor. We sat through the instructor's lecture, filled out an evaluation form, and then sat down with the instructor after a lecture to give positive and constructive feedback for potential changes in the future.